I'll call the Board of Commissioners work session June the 6th, 2011 to order. At this time, we have before us the proposed agenda for the June the 20th, but that we're going to go over with today. As it relates to today, if everybody could get a chance to look at A, B, or A and C on our proposed agenda right now, and see if there is a motion to transfer that to June the 20th, 2011, and that's the approval or correction of the minutes, and then recognitions for the from the Arena and the Event Center, Cooperative Extension, and Transportation. We have a motion to add this to the June 20th agenda as it is. Do we have a second? Motion and a second. All in favor say aye. All opposed. Motion carries. Under F, consent agenda. Once you have a chance to look at that, if we have a motion to place that under the consent agenda for June the 20th meeting.
So moved.
We have a motion. We have a second. All in favor say aye. Aye. All opposed. Motion carries. The first new bit and matter that we're going to be discussing today is the Parks Department G1. It's adoption of an ordinance amending Chapter 50 Parks of the Cabarrus County Code of Ordinances. I call on Mrs. Strong at this time and Mrs. Ray.
Good afternoon. Just to go along with what you had in your agenda packet, a little summary. Our Park Commission brought up to the staff about 6 months ago the possibility of looking into prohibiting tobacco products in the park. So we started researching that. Got with Joanna Ray and with the Health Alliance, City of Concord, Kannapolis. We got all of the municipalities together and had some meetings. And after that, we had the development of the proposed ordinance. Joanna worked mostly on that, and if she wants to say anything about that, I'll be glad to let her do that at this time.
Well, I've researched different policies and ordinances that have been implemented in North Carolina as well as other states in the United States. We looked at the North Carolina Tobacco Prevention and Control Branch. They helped with a lot of support, as well as Aaron Shue with the Cabarrus Health Alliance.
Through our state association, what I have found is that there are 32 cities and 12 counties at this time that have some type of tobacco policy in their parks, whether it's smoking or all tobacco or specific areas. That was not broken down as to which, but so that would be 32 and 12 for the whole county, for the whole state. We have a presentation from the Health Alliance from their teen, I'm sorry, I forgot the name of the group.
Teen Task Force.
Teen Task Force, and they would come forward.
If you would please introduce yourself so we know who you are.
Yes. Good afternoon. My name is Erin Shue, and I coordinate the Teen Tobacco Use Prevention and Cessation Program at the Cabarrus Health Alliance. Before I let them introduce themselves, I wanted to tell you just a little bit of background, but first, thanks for giving us a few minutes to come and share with you on your very busy agenda. We found that tobacco use, especially among youth, was a problem dating back to our 2000, 2004, and then again in our 2008 Community Needs Assessment, which is an assessment done every 4 years by Healthy Cabarrus at the Cabarrus Health Alliance. And so through that, we developed a teen tobacco prevention program, which has been in place since 2006. So I have the pleasure of working with teens throughout our community. I feel like I'm one of the luckiest people in what I get to do every day. And so these are three of my most veteran members, have been working with me on tobacco use prevention sessions, but also on policies that affect teens and youth. So that's why we're here today. So I'm going to introduce to you, starting on the end, Jordan Tucker is a senior. Well, you're a senior until Saturday at Central Cabarrus High School and will be going to Alabama next year. Rachel King in the middle is a senior at J.M. Robinson, will be going to Appalachian State. And Femi Balican is a senior at Central and will be going to Wake Forest. So what we did is we put together some information about why we feel like this is a step in the right direction, fact-based things that may be helpful in your decision making. So next slide, please.
Through our survey at the local parks, we feel that this policy is important because of the following reasons that you'll see in this presentation. Next slide, please. First off is secondhand smoke. And not only is it harmful in our environment and in our home, it's harmful outdoors. And a majority of the cigarette butts that we found in April at the park was around the playgrounds where the children play. And we feel that that increases children's exposure to secondhand smoke even more, especially when they're coming to the park to enjoy the outdoors and there's an environment of cigarettes around them, and it increases the secondhand smoke.
Parks are family-friendly venues, and when one takes their family to the park, the last thing that they would want to see is a whole group of people or just one person around the area that their children are playing smoking, because that secondhand smoke is very harmful. And a majority of the teens that begin to use tobacco are because their family or close friend use, and that can be contributed to the use of the parks as well. And adults should model their healthy behaviors to the youth, because that helps to decrease the risk of non-healthy choices in the teens. Next slide, please. The litter cigarette butts are the #1 item littered in the U.S., and we actually found over 250 cigarette butts in April when we helped clean up Franklin Park. Smokeless tobacco is also a contributor to litter. The spit cups and the large clumps of smokeless tobacco that can be spit out onto the roads and into the parks is very harmful by the kids and the pets that could also pick up that smokeless tobacco and actually might contribute to eating it, which is very not good at all.
As you may know, smokeless tobacco is also a public health issue, just like secondhand smoking is. It's safe to say that there is no safe level of tobacco use or secondhand smoke exposure. In a peaceful park setting, the sight of smokeless products also does not complement the beautiful atmosphere of a park. You want it to be peaceful and beautiful. And in addition, there will be signs needed to promote a tobacco-free atmosphere, or if it was a smoke-free. But the more inclusive and clear sign choice would be one that expresses a 100% tobacco-free park. And overall, the reality of it is the overwhelmingly majority of North Carolina citizens do not use tobacco, and the majority of North Carolina citizens will support breathing clean air. And ultimately, being 100% tobacco-free will set the standards high for our community to promote health in our area.
So what are y'all recommending? Besides being smoke-free, what is the changes in the ordinances, or what do you think needs to be changed?
For me, I feel like a tobacco-free park would help set the standard higher for people. We've already have tobacco-free restaurants, which is a very good step in the right direction. So by having tobacco-free parks, it'll probably help decrease the amount of people or the amount of youth who might start smoking, hopefully.
Even on the baseball fields?
Especially on the baseball field.
Any other questions for the young people? Thank y'all. Thank y'all very much. This would be a modification to our ordinances. I do not believe we need to have a public hearing on this. Do we want to place it on the consent agenda, or would you like to place it on the regular agenda?
Make a motion to put it on consent.
Okay, we have a motion to place this under consent agenda to modify the ordinances saying that the parks, all of our parks, the county parks, will be 100% tobacco-free, smokeless, and smoking. There is a motion. There's a second. Second. We have a motion. We have a second. All in favor say aye. Aye. All opposed. Motion carries. Thank you all very much.
Thank you.
Thank you.
Next we have is on page 154. It's a request by Harrisburg and Charlotte Mecklenburg Utility Department for transfer of ownership of water sewer lines in Cabarrus County, page 154. This time I'd call on Mrs. Reep-Smith. And, do you have anything to present in this, Mrs. Reep-Smith, or? Okay. If you can introduce yourself and let us know what your thoughts are.
Okay, thank you. I'm Todd Taylor. I'm the Public Works Director for the town of Harrisburg, and we're here today to present an opportunity that Mecklenburg County and Charlotte have been, Harrisburg have been working together on for about a year now. As part of Mecklenburg's annexation area, there's a large utility system that will be purchased to provide those citizens in that area with water and sewer services. Part of that utility system extends into Cabarrus County and encompasses 4 neighborhoods, namely Cabarrus Woods, Bradford Park, Britley, and Steeplechase. The town of Harrisburg intends to purchase those systems from Charlotte after they complete the purchase with the private utility company, which is Utilities Incorporated. The contract has been signed between Charlotte and Harrisburg. The Utility Commission is reviewing the contract between Utilities Incorporated and the Charlotte Mecklenburg Utility. As part of that, they have put a requirement in there that Charlotte must own all of the utilities, including the ones in Cabarrus County, for a period of time. So what we are asking for today is there's a general statute, I believe, that requires Charlotte to ask permission from Cabarrus County in order to own property in Cabarrus County. And Barry, do you have anything that you want to add to that?
Just one thing, yes. I'm Barry Sharon, Chief Engineer for Charlotte Mecklenburg Utilities. Originally, we had intended to do a direct property transfer to Harrisburg, but through our ignorance, for lack of a better reason, for working with the Utility Commission, they issued their order as if Charlotte Mecklenburg Utilities was buying the entire system. So it was really going to affect the schedule and complicate it, and with the state statute that says that we have to have each other's county commission approval to own real properties across the county line. Everyone felt it was probably easier to get that permission with the idea that Charlotte will probably only own those customers for a matter of days before we make title transfer. But it's really a function of, we're asking for that approval so that we don't have to start over with the State Utility Commission again. And they recommended that was a much cleaner process to work with Charlotte, adopt their order, and then we'd make the transfer to Harrisburg.
Any questions? How did CMUD come to own property in the first place in Cabarrus County? If it says, it was saying here that they intend to purchase from CMUD infrastructure previously owned and operated by Utilities Incorporated.
We don't currently own any of it yet, including the Mecklenburg. This system we're purchasing is before the Utility Commission for consideration for us to purchase. If we get approval, that wouldn't happen until late June. But I guess the short answer is, if, for instance, this board, for whatever reason, didn't want to grant that approval, we would literally have to go back to Carolina Water and carve that part out of the equation. But so we don't own any.
Let me rephrase what I was going to say then. You're buying Utilities Incorporated. Is that it?
We are buying some of the systems they own, correct?
Okay. And Utilities Incorporated owns some things here in Cabarrus County.
Correct.
And then Harrisburg wants to buy that part of Utilities Incorporated.
Right.
Okay.
I guess the confusion comes in that the deal has to work that Charlotte has to buy everything and then turn around and sell everything to Harrisburg. And that's where it gets a little complicated, because what we wanted to do in the beginning was basically have a 3-party agreement, and that wasn't possible. So basically, in a matter of days, Charlotte's going to turn around and in turn sell the systems in Cabarrus County to Harrisburg. So there's two agreements there. There's one between Charlotte and Utilities Incorporated, and then there's one between Harrisburg and Charlotte.
If Harrisburg is buying this, how is it that in just the purchase alone, you're going to save the homeowners 15%?
Well, actually,
Or, excuse me, 25%?
the rates that Utilities Incorporated is charging now are significantly higher than the rates for the town of Harrisburg. So the customers will see a reduction in their water and sewer bills as a result of this purchase.
So is the company, so in the town of Harrisburg, will own this, you're saying their rates are that much lower than the company who currently?
Utilities Incorporated's current rates for their average customer would be about $80 a month. Our outside customer rates for the town of Harrisburg are about $53 for water and sewer services.
Is there a reason for that significant difference?
If I had to guess, I would say that private industry is out to make a profit.
It also depends on how many customers they have too, don't it? What the cost is to them.
That's correct.
Now, this also is going to tie in with the new interceptor line coming through here that Wasac is building. And that interceptor line, I believe, most of the revenue from that is actually going to come from CMUD, I believe. Yeah. So, and all these systems will tie to that. So it'll also have the effect of shutting down the package treatment plant and everything that's there. And therefore, could potentially be a huge public health nightmare if the system ever failed there. So,
how does this affect, and y'all may have this question, does this affect Wasac at all?
No, in the beginning.
And I'm talking about to the negative. If it enhances there, then that would be great, but I just want to make certain it doesn't.
Actually, it helps them because that line that you're speaking of, Mr. Caruth, is basically an empty line at this point until Charlotte and Harrisburg begin to make connections and deposit their sewer in that line. It's basically a piece of capital or some capital that's been invested that they're not using.
Now, does that in any way affect the IBT? And what I mean is, years ago when the IBT was all in the news, it was talking about returning water from where you got it. If this connects, there's water involved. I mean, does that water get returned back to, obviously treated, but gets returned back to the source?
Yes, this entire area is in the Yadkin part of the Mecklenburg County. Mecklenburg County has a section where part of it drains towards the Catawba, part of it drains towards the Yadkin, and I believe this area is part
I mean,
of
that's
the
being
Yadkin.
addressed, is that it's going back to the source in which it's being pulled from?
Actually, ours will not. Ours will be under our interbasin transfer permit. Because you're right, currently the water is from wells that are in the basin, whereas our water's coming from the Catawba and will hook to our system. But it was planned for under our interbasin transfer as of 10 years ago.
So at least if that's an issue, there's an answer to it, and it has been addressed.
Correct. And we've talked to the state drinking water and wastewater agencies, and they're very much in favor of this because they see a numerous wells being shut down, and I think we're taking 4. In this purchase, we take 4 of those wastewater treatment package plants offline and put them on the public systems.
Do we have to do a resolution? What do we have to do as a county? Or is it just a matter of a motion to allow CMUD to do it and purchase this property in Cabarrus County? And do we put a time limit on it?
Yeah, we need a motion to, I'm sorry. We need a motion to give permission for Charlotte Mecklenburg to own property in Cabarrus County. We have it at about 10 days, 2 weeks.
Okay.
So we think we'll be finished by then.
Is the 10 days or 2 weeks after the 20? I mean, I'm trying to figure out the timing here. Is if it gets moved to our 20th agenda session, and we put it under new business, that's one thing. If we put it under consent, before it gets to consent, there needs to be a time frame in there that it needs to be transferred to Harrisburg on or by a certain day, is the way I look at it.
Okay, if that's the case, then we need it, after the deed is transferred to them, we need it 10 days after that, because we got to go through that process after they get the property, because they don't have the property today.
Right. Any other questions? Well, the way I see it is that if this goes to the consent agenda, it needs to be going to the consent agenda to approve CMUD owning property in Cabarrus County for it to be transferred within 10 days of them receiving title to the property. Does that make sense? If we don't want to put it on a consent agenda, if we want to talk about a new business, then at that point in time, we may have a date that the deed is transferred to CMUD, and then we can add 10 days to that if we wanted to put it under new business. But what's the preference of this board?
New business.
Okay. We have a motion to place this under new business. Do we have a second to place?
Second.
We have a motion, we have a second. All in favor, say aye.
Aye.
All opposed? Motion carries. I would suggest if you can just let us know about when CMUD plans on taking title to it, June 15th, June 28th, July, whatever, that then we know what dates we're talking about if it passes then. Okay?
Thank you.
Thank you.
Thank you. Next matter we have is on page 159. And this is the contract to provide tax district fire service. And at this point in time, I would call on Mr. Bobby Smith and Mr. Steve Langer.
Good afternoon. Appreciate the opportunity to come before you again with this matter. As you recall, in March, we issued a letter to the Jackson Park Fire Department that it was the county's intent to no longer contract with them for fire protection in the Jackson Park Fire District. We provided you with some follow-up information after that and a staff recommendation to contract with the City of Concord to provide this service. We are here before you today with that contract for your consideration to contract with the City of Concord effective July 1st to provide the fire protection for the Jackson Park Fire District. I believe this not, and County Attorney have to correct me, I believe there's another version of this contract or a corrected version since we published.
That's correct. I received a revised contract at the end of last week. The only substantive change between what's in the packet and in that new contract is that the term is for a flat 20 years. It doesn't have an automatic 20-year renewal on it, but aside from that, it's the same.
Are there any questions for Mr. Smith, Mr. Langer, or Mr. Cook?
So the fire tax will just be redirected to the City of Concord for the contract cost, is that?
Yes, sir.
Just be even.
Right. Yes, sir.
What happens to Jackson Park Fire Department?
At this point, they are, from my understanding, from information and emails we received, they are in negotiations or talks with the Town of Harrisburg Fire Department for merger of their personnel and assets. I don't believe any documents have been signed at this time, but the last email I got was that that offer had been extended to the department. I don't know if the department has responded to that or not.
Do they have the funds to do that now? If we take this money away from them,
The funds to,
go get through the merger?
I would, yes, sir, with the only liability they have right now, from my understanding, is the financing on one apparatus. I'll have to get Steve to correct me if I'm wrong.
I think it is worth mentioning in the previous, one of our budget meetings, there was discussion with the town administrator from Harrisburg of whether or not Harrisburg would be an option to contract with, and correct me if I'm wrong, but from what I remember, she said that the town of Harrisburg was not, at the point of where they would be willing to contract. So I think that is worth mentioning for the fact that the City of Concord was selected based upon the discussion of who would take this contract.
Yes, sir.
Also location, I believe that Concord is the closest to this area, if I'm,
Yes, sir. They have and there's a map attached, I believe, to your agenda item that shows the location of Concord Fire Station. There,
163.
Yeah, I want to add to what Commissioner Meisner said. I think too, looking at back several years ago, and it kind of ties in with water because water is such an important part of fire protection, is that I know that the municipal service areas as well as annexation agreements are worked out between Concord and Harrisburg. For us, it really wouldn't be seriously considered giving it Harrisburg because then you would be putting, again, be balkanizing things by putting them over into the contract with Harrisburg in an area that's clearly right in the middle, almost in the middle of the city of Concord, surrounded by city limits of Concord. I think it does make sense that Concord would be the only really logical fire service that we'd go with here.
what happens to the fire station if it no longer, if the volunteer fire department no longer exists?
As a nonprofit corporation in North Carolina, their board of directors will decide how their assets are distributed. That'd be entirely up to that board on how they would either sell or transfer that property. I do know there's some deed restrictions on that property that the board would have to work out, but again, that would be entirely up to their board of directors.
And looking at this map, it looks as though the fire department's not even in the district. Am I looking at this correctly?
That's correct.
You're correct. The department itself is actually in the city limits of Concord.
Okay. Any other questions? Whoops.
I also want to point out, Mr. Chairman, as well on the map, that you look at the area that is, the fire district that is left, it's not in the city limits. Appears that almost a third of it is the area there in the northwest side is actually Frank List Park. So,
Talking about up here?
No, that open area right below there, the blue area. Mm-hmm. All that is Frank List Park. And so you're looking at, basically, you look at the other areas are pretty well surrounded or penetrated by residential areas, including there's an industrial area, looks like up off of the bypass up on the northern section up there on the Warren Coleman Boulevard. That, I guess it's one of those islands in the city that's not been annexed into the city. It sits there around Zion Church Road. That's true.
And there's also some property that the city has put forth for annexation of their district that would take effect, I believe, June of next year.
Okay, so if we were to, if this, no matter what happens, if we agree to it, then there's continuous fire protection starting July 1.
Yes, sir.
And there's a potential for a reduction in ISO ratings for homes?
For commercial properties, there will be a reduction. For rental property, there could also be a reduction. In homes that are rental property, the homeowner could see a savings based upon their insurance company.
And in regards to homeowners, it's going to stay the same?
Yes.
Okay. Any other questions? Do we have a motion to place this under consent, or do we want new business?
I want to make a motion that we place it on the consent agenda.
We have a motion, we have a second.
Second.
We have a motion, we have a second. All in favor say aye.
Aye.
All opposed? Passes 4-1.
Thank you.
Next is on page 164. That is a selection of weatherization subcontractors for 2011-2012. Call on Mrs. Sifford.
Good afternoon. Last year, Cabarrus County did its own request for qualifications, as each agency across the state did. This year, the state decided to do a qualification statewide and have the subcontractors list what agencies they would like to work for and do the approvals through them. Once we got approvals, we had to send them to the state for them to approve anyway. So this simplified the process for the contractor and for us. So I'm looking for approval to piggyback on their list. They have not actually published it yet, but I have advised all of the contractors that we are using and all of the ones that have contacted me to go through this process because it will be more simple for them. It gives them access to more agencies to work for, as they can list whatever counties they want to work in and give prices for those counties. So they do one application to the state for however many they want to work for, rather than giving me one and giving one to Salisbury and giving one to Gaston. So it's a little simpler for them.
Any questions from Mrs. Sifford? Does this exclude any of our contractors from working here in Cabarrus County?
Not that I'm aware of. Like I said,
It sounds like it expands their ability to work wherever
that's
they would
what
like to work.
Yeah, that was what my attempt to help them was, to say, okay, you can list me and you can list all the ones around us, and then any of those agencies can come and automatically contract with them rather than having to go through all the state approvals and all of that. It simplifies the process for everybody, and they were all advised to do this.
What happens if there is a weatherization need and a bidder bids a ridiculously low amount, but they're from Brunswick County? Do we have to select them?
No, this process, actually, we can just go out and grab whoever we want.
Okay.
The bidding on this is a little different than typical because they're bidding an average price. We don't bid by job on this. So like the contractors that we used gave me a list of prices for typical items. And so we know going in that those will be the prices for those items, and then other things are priced separately.
But what I'm going to make certain is that if it's a low bid from out of county, that they just can't meet it.
No.
We don't have to select them.
No.
Okay.
No, you can go out and select whomever you want off of that list, as long as they presented a price for Cabarrus County.
Any other questions? We have a motion to place this under consent agenda. We have a motion. We have a second.
Second.
We have a motion. We have a second. All in favor say aye.
Aye.
All opposed. Motion carries. Next matter is a continuation of budget discussions. That's found on page 219. First is the Cabarrus Health Alliance funding contract. At this time, I'd call on Dr. Pilkington and whomever else you'd like to call up, Dr. Pilkington.
Have Mr. Phillips, our board chair, and Ms. Kesterdale, a member of our board, have been this as well.
The discussions that we had on Wednesday was to fund, or to be specific in regards to our contract with the Health Alliance, and the preliminary discussions were for the mandated, also for the mandated services, as well as approximately, and $4.2 million is what was discussed. There was some questions from the board as to whether or not it needs to be $4.2 million or less, and that's the reason why it was brought in here today, as to if it's less than $4.2 million, there's nothing specific at that point in time. Some further review of the information was requested, and that's the reason why we added it today, Dr. Pilkington. I don't know if there's anything you want to add, or if there's anybody, the board, that has any questions for Dr. Pilkington right now for a reduction from the 4.2, and let me get the exact number. It may be more than that. I apologize. $4.231949, $4,231,949. The discussion that we had as a board was the nursing program was very important to make certain that is fully funded, and then from that go to the funding of the mandatory service, or not from there, but also fund the mandatory services, to let you know what the discussions in general were. If anybody wants to change that, or if there's any differences, let me know. But does anybody have any questions for Dr. Pilkington as it relates to the $4.2 million and whether that needs to be reduced or not? And Dr. Pilkington, if there's anything you want to add or if you want to discuss anything further, feel free, or Mr. Phillips.
What's the total amount of that $4 million mandated?
It's,
In rough numbers, and Dr. Pilkington, correct me, what we were talking about in rough numbers, what's mandated services is about $3.5 million. And the nurses, school nurses came up to about $653,000, and then there was a $40,000 for human resources, and then a small amount for something else that I just don't remember. But for the most part, it's 633 or 643 was school nurses, Commissioner Burge. So the mandated services is $3.5 million.
That includes that $634,000?
No, sir.
That goes on to 3.5?
That adds to it, yes, sir. That gets it at 4.1, and then the difference is, like I said, a $40,000 added to it of human resources, and then there was something that was a little bit under $10,000 to round it out to the $4.2 million.
So what are we questioning on this amount of money?
In our discussions on Wednesday, what was questioning was whether the $3.5 million, those mandated services, do we have to fully fund those? And if we weren't going to fully fund those, what could be modified in that 3.5 and how that would affect? And when we were discussing it, there was maybe not enough information. That some of us wanted to have further information to digest it, to decide whether or not is there a certain program that need to be maybe not fully funded and how that would affect. And that's the reason, one of the reasons why Dr. Pilkington is here.
I thought if it was mandated, we had to fund it.
Well, just to clarify a little bit, 3 of the programs on here and the 3 that were specified in the documents that were passed out at the last meeting, communicable disease, vital records, and environmental health, are mandated programs. And the direct costs are listed here in that chart. Anyway, the direct costs are listed, and then there's some other costs that the chairman was talking about that have to do with information technology, the general administration, human resources, and finance. Now, those aren't strictly mandated services, but they are in support of the mandated services, but they also support other services that are provided by the Health Alliance. So in general administration and information technology, that's the whole system that supports everything. So I think it's reasonable to say that obviously some of it's supporting services that are not mandated, but it's necessary to have the administrative support to provide even the mandated services. So the levels of service are a different story. So you can have different levels of service provided not just in administration, but also in those mandated programs. So while I think Dr. Pilkington said that there hadn't been an increase in the number of employees in environmental health since like '94 or something like that. So obviously the level of service is not as high as it once was if we've had a great expansion in the county and population and restaurants and everything else, but the number of staff people hasn't changed. So when it's a mandated service, it's often the case that the level of service is not specified, and that's something that where you have discretion. Does that help or make it worse?
No, I mean, I wonder why are we questioning his budget? Are we going to, is this not your budget?
It's our board's budget, yes.
Yeah. I mean, what's on here that we're questioning the amount of funds?
The question is there's the 3 mandated services, and beyond that, there are services that the Health Alliance receives grants from the state, various grants, wherever they come from, that supply other services, correct?
That's correct.
The general administration total is $2.5 million. So 2.5 million of what money we give to them, that's not mandated. However, you do have to have some employees, obviously, to operate the program. However, 2.5 million is much higher than the amount of money that is the cost of the direct program, the direct cost of the program. So if you have a program, if you have a direct cost of the program, if that's just, I guess, the items needed to provide that service, then you have staffing levels that are much higher than the amount that it takes as the supplies just to offer that service. I guess my question is how, for some of these, for instance, if you receive a state grant, community grant, regardless of what type of grant it is every bit of that money directed towards the supplies of that program or organization of that program and no money put into the general administration for that program? Or is the money that we put in for the general administration for, every bit of that? That's my question.
That's an excellent question. If you notice, one of the things about our budget is the county's contribution is about 25% of that budget, roughly. Each year that number changes. Since we're getting a variety of money from the federal and the state sources, we put different pots together regarding requirements to keep those funds going and keep those programs going. For example, as I mentioned last time, one of the programs we're not going to continue is our school daycare nurses because it requires a $100,000 plus match from us to keep those nurses out in the field. We don't have that $110,000 anymore from local monies, so we cannot continue that program. Those state programs all specify that money has to go to those programs. For example, maternal and child health has to go into operating those maternal and child health clinics, and it can't go anywhere else. So we try to find, and we scrap, and as I've said before, we essentially are operating with a negative increase in the county over the last 10 years when you add in the consumer price index. The amount of money the county has given us over the last 10 years has never even equaled the amount of money we have in an increased cost in health insurance for the employees we have. So each year we're scraping to just try to get by to cover the basic expenses of the organization. And at the same time, the county is netting about $1 million a year off of that. So it's a really good trade-off in terms of the counties, because as I said earlier, if you want to put us back on the county payroll, you'd see an increase of about $1 million instantly. So over what you're adding here.
I mean, that's one way of looking at it as well. But on the flip side of that as well is, I think part of a discussion at some point should be that never did take place previously was, if you're going to forego $200,000 a year in rent from the not having to pay towards the county, and now the county is building a new building for the Health Alliance and not going to charge any rent. So on the flip side of that as well is, you're also getting that increase of not having to pay the rent on that building. So there's argument on both sides of that.
Well, I would agree, but without exception, as far as I know, every county in North Carolina provides the public health department a facility without any charge.
We were the only one paying rent in the whole state.
We could have just not charged you rent at the old Kmart building, and then
that would have been
nice. Instead of building a $13 million new building.
Yeah.
So.
One thing that wasn't directly apparent in what Fred said, that the county contribution is 25% of the budget. That means over $9 million is coming from other sources, and you will not see that in any other county in the state. The way we are organized provides us with tremendous flexibility, and part of what you're getting for that $2.5 million in administrative costs is the ability to bring in $9 million to the community to fund programs and we have had a community partners series of meetings that Commissioner White attended, and we brought in the key players in the community and had very good attendance. And we identified their key issues. School nurses were one, the clinical services we offer were another, and so we have identified the things that the community really feels is important, and we're bringing in a lot of outside money to make those happen. So that's part of what you're getting for that money.
Unfortunately, we're in financial crunch just as everyone else is, and so that's the purpose. That's our job, is to review where the money is going and what services are being provided. And, certainly I understand that argument. However, that's part of our role here is to review that and to see what is mandated and what's not. And of course, throughout life, there's things that we, truly want, but it's whether or not we can actually afford them or not. So that's a position that, we are put in to try to decide that. But, for instance, the programs, so going back to my earlier question about, if you receive, whether it's federal money, state money, community grant, as you were talking about, what was the adult, which program did you give?
School daycare nurses.
The school, okay. And you said that the state gives you that money that you have to put directly into that program. I understand that. However, where is the staffing? Where is the money? Is there a portion of that grant going towards staffing, or is it just going to the program?
In our budget, almost everything goes towards staffing. If you look at our budget, about 89% of it is in human resources costs. It's salaries and personnel. That's the way it is in healthcare everywhere. Almost everything is bodies on the ground. The one thing I should say, and you probably saw the flurry of email exchanges this weekend, that is of concern to us is that this designation or allocation of money that this board has required of mandated services does present some problems, because we have a maintenance of effort requirement that says the same amount of local dollars, so that they're not supplanted, or the state money and the federal money is not supplanted, must go in the next year. We can generate, or I can see through our budget, about $440,000 through dental revenues that will take care of almost all that. We're about $110,000 short, and if we don't generate, I'm looking at maybe $70,000 in addition in case dental doesn't generate that excess money, that we won't have that local money. If we don't meet that maintenance of effort requirement and can't demonstrate that in our budget, we can't provide clinical services. And we take care of 2,600 children right now for primary care, and 900 mothers, and they will not, there's no way we can operate those clinics without that maintenance of effort requirement being built in. And we get from the state in return for that about $245,000 in grants, and we generate right at $1 million plus in Medicaid revenues, and those again go back into supporting those programs. So that's a serious concern. We have built, I didn't want to get on my soapbox because you don't need to hear it, but we have built, by all accounts, probably one of the best health departments in this country. We're highly regarded in what we do in our health department. We are very proud of the services and programs we offer. You have made a decision to only fund mandated services, but there's a great deal more about what public health is than mandated services. The young ladies who just sat in front of you aren't mandated services. We do a lot to promote the public health of the community. Those clinics are critically important. We keep our infant mortality rate down. We keep our children healthy. If there's a misconception that these are all people who don't work, that's not true. These are working poor who come to our clinics by and large. These are people who have jobs. They just can't afford the care that is required for them to pay for health insurance and other things. They just don't have that ability, so they're getting their care through the health department. Health departments nationwide have always been considered the provider of last resort for health care. And that's, if somebody else stepped up and did it, we would be more than glad for them to do it. But there's nobody to step up and take care of these 3,500 people in this community. Hasn't been for 60-plus years. I don't see it happening tomorrow. And we feel like we do a great job with it with our staff. We do a great job in results. You just saw the rankings. We came out as one of the top 8 counties in the country, in the state, out of the 100 counties in our rankings for health, the health of this community, which is pretty credible. And a credit to all of you. We've had a long-standing relationship with this board that goes back, we're 100 years old this year. As you know, that this has been a very highly supported public health department. We are ranked in the top 10 always in per capita contributions from our local board of commissioners. As I said earlier, we've slipped a little bit, but we're still in the top 10. We certainly don't want to go to where some of those counties are, and if you look at them, they get 66 cents per person for public health. We sure don't want to get in that position, but if you also look at those counties, then they have terrible numbers in terms of infant mortality and morbidity within their communities. So we certainly don't want to get there, and we do appreciate the cooperation and the collaboration that we've had from the Board of Commissioners, but if we have to go to this particular specific allocation for mandated services, it does present some problems for us. We can get away fine with all but about $180,000. That $180,000 is a concern to me.
How did the health department or health departments across the state get into the position of being the provider of last resort when I was growing up, it was always the public hospital that was supposed to be the provider of last resort? They're supposed to be the ones, and you always hear about it, is, well, we can't turn anybody away. We can't turn anybody away. Well, it appears to me that they're turning away 3,500 people in our county. How do they get away with that?
They can't turn them away in the emergency department, and if we release this 3,500, that's where they'll get care.
Okay.
And it's episodic care. It's not good care. Not in terms of quality. It's not good to show up only when your child has an ear infection for 6 weeks. It's not a good time to show up at the ED, because then you have more serious problems. You end up with hospitalizations. A lot of these folks qualify for Medicaid. They end up costing our healthcare system a lot of money and our taxpayers a lot of money. So the idea is that if we can head those things off through a good preventive health system and good quality care up front, that we stop that. You're right. When I grew up, it was the same way. And I grew up a couple of counties away. But the public health department there did do primary care at that time in Gaston County, still does, has a very large service called Gaston Family Health. And we have the South especially does, I don't know if it's because we've had more poverty over the years, but the South especially does more primary care in public health than anywhere. And that's been kind of our legacy in public health in the southern United States.
One of the advantages to having clinical services is it gives us a significant reserve of staff to meet public health emergencies. Like when we had the hepatitis A outbreak, we were able to immunize 1,800 people in 31 hours because we did have the nurses on staff. So if we can come close to breaking even through Medicaid and other the people who are able to pay, it gives us a huge reserve in terms of personnel. So that's what I mean, I'm pretty fiscally conservative. What I'm looking for is breaking even as close as we can, and that gives us a huge reserve to meet the public health emergencies that we have had in this county. So the cost is pretty modest in terms of what it is actually costing the county to provide those clinical services, but the advantage of having that reserve is huge.
But the question gets back to, it's not a service that the county has mandated. It's a service that is a direct benefit to the hospital, and the hospital is not stepping forward, that is a profit maker. I mean, they made a serious amount of money last year, and they're not stepping up saying, we appreciate what you're doing. We appreciate taking 3,500 people from our emergency rooms. How do we answer that? And it's not it's not an issue with the health department. The health department's doing everything they can, but I look at it as they don't pay taxes, they take money from us, and when I've had 2 surgeries on my knee, it cost more the second time than the first time. You know, and it keeps going up and up and up, and you know, that's what I'm trying to figure out, is they receive a tremendous benefit from the health department, and it is upsetting to me that they don't recognize that as a financial contribution to help the health department.
I think that's certainly a topic for future discussion.
And this is the impetus to give them a topic of future discussions for them.
Well, I don't know what we do in terms of maintaining our reserve, but
Well-
if they took over clinical services, we'd have to do something, so.
And that's what I'm trying to say is, if they don't see the tsunami coming, they will. I mean, that's the issue, is that they're sticking their heads in the sand, not addressing the issue. And they're just trying to figure out how much more money we can make off Cabarrus County citizens. And that is appalling to me, when there is a need that y'all are providing that they can come to. That's where I look at it, is that you're right, is the county has been providing some of this in the past, and you know, I don't think it's a $180,000 decision. I think it's a $2.5 million decision that they're receiving that amount of benefit.
It's a much larger decision, and it's not any additional cost to it. It's not $180,000 more dollars. It's just that we moved money from one pot to another.
Right.
That's all we're doing. And
You know,
that's,
I
and we've
think-
been moving lots of pots. For example, one of the things you talked about was your school nurse priority. And one thing I would point out to you is that when the school nurse program started, and it was something that I championed and fought for years, that program started because we took $500,000 out of clinic, not from the county, and started that program with $500,000 coming from both the schools and the hospital. The hospital kicked $250,000 to start our school nurse program, and we got it going. It's been you heard me say the other day, it's been a financial burden on us because we have had 2 years ago to come up with $250,000 more to keep it going when we lost the Medicaid money that was going into it. Schools have had to reduce people to keep it going. Liz knows this. They cut out somebody in the front office in every school to start the school nurse program going. So it's been a real community effort to keep it there, but it's been an expensive effort. At the same time, we're losing 6 to 8 school nurses every summer because we can't provide health insurance for them. We work them 6.5 hours a day because that's all we can afford with the budget we have. And some of these ladies can't keep working without health insurance, so every summer they quit on us, so we're filling that many new positions every year. So that's a program that struggles just to keep above board. So I would suggest if you're looking at things you need to look at, we need to figure out a way to give those ladies health insurance. They don't have it. And that's sad, because they're providing health care to thousands of kids in the community.
But I think that's also a topic for future discussion. This is the budget you're having to deal
Yes.
with today, so.
Any other questions or anything else? So what I'm hearing you say, Dr. Pilkin and Mr. Phillips, is that as it is right now, y'all will have a serious problem in regards to clinical services.
That's
Unless this board approves an additional $180,000.
To be moved, lets us
No,
have
no
flexibility.
more money.
That lets us have the flexibility to take $180,000, that 4.3 million, and put that into clinical services as opposed to somewhere else. It doesn't matter where else. It can be from IT, it can be from anywhere else.
Another way to do it is not specify where the money goes.
That's
in
basically the
contract
bottom line,
between
yeah.
the county and the Health Alliance, but specify the level of service that you want to receive for specific programs. So
Yep.
if you want to have a level of service in school health that, say, equals the number of employees that were in that chart, then you can have that as a contractual element, and it ensures that the service that you have as a priority is provided at that level, but it doesn't restrict how the Health Alliance moves money in between programs. So that's
We
another
appreciate the
option.
guidance that you're giving us in terms of requesting that we put most of this money toward the mandated service, and we would certainly strive to do everything we could to make that happen. But as Dr. Pilkington indicated, there's about $180,000 that would present a serious problem in terms of operating the department. And if we had a public health emergency, it would be hard for us to sit here and guarantee you that we would be able to accomplish that, because we would have to be moving things around. And so we would certainly do everything in our power to make sure every county dollar was spent on a mandated service, but it's real hard to guarantee that.
In a time of emergency that you keep referring to, wouldn't there be some sort of working with a hospital and other organizations in some sort of, public emergency like that? There would be support from,
The hepatitis A.
I mean, all of it.
I would hope
Is there
that
a
would be the
plan?
case, but I can give you, there is plans in place that we would have backup. For example, I gave you the smallpox scenario last time, and we have almost anybody in the community lined up who can give a shot. Veterinarians or anyone else.
Right.
On a list, ready to call. Because we've got 72 hours to give every one of you a shot. So that's serious business. But when it comes down to hepatitis, that occurred in the middle of the winter during an ice storm. The hospital was inundated with people falling and breaking limbs. They had no one to free up. They had people working overtime because folks couldn't get into work. So we had to do those vaccinations. We actually had to, Food Line was the entity involved. They hired a private corporate jet or sit their own private corporate jet to Michigan to get the gamma-globulin we needed to give these folks. Otherwise, because the airports were shut down, everything was, I mean, in an emergency, Bobby will tell you if he's still here, things just don't stay the way they're supposed to be in an emergency. So I would like to think that we could count on everybody, but we really need that kind of core personnel and staff, and we don't need to justify clinics for that reason. But I tell you, in that particular case, it was nice to be able to call all those nurses in and say, we're going to work 24/7 until we get these 1,800 people immunized. We don't have any choice. And we did it. We got it done. But it was difficult, to say the least.
Commissioner Cruz?
Yeah, I just point out, and I think the important thing for us to all realize here that, and I think Mr. Phillips' point I want to go, is that, that they're going to make efforts and put the money with the mandated services. The maintenance of efforts got to come next. And then I think that we've got to understand the very nature of why this board is not the Board of Health, why we have people on the Board of Health that are involved in the healthcare industry, and why we have a director that's about 30 years in it, because none of us over here are public health experts. And I think that we've got to just construct this and make this a maximum flexibility to be able to use that money, because I agree with you. I think that when we were sitting here and looking at the clinical services for these 3,500 people, if the only option we have is for them now just to go to the emergency room, if it's not provided, then the ripple effect of that, looking at it from a risk management standpoint, the ripple effect of that in the community is going to be tremendous, because if a lot of them are employed in jobs where they don't have health, any kind of health insurance, can't make enough money to go to pay a doctor to go to the doctor, then when they get to be so sick, they're going to start being out of work. Then they're going to become unemployed, because I'm sure the employer's probably not going to put up with them being out of work for extended periods of time. And then what you're going to end up with then is, it's a snowball effect that's going to happen. And I remember back when I first came on this board 10 or 11 years ago, there was some discussion then, and I think it was the community care plan is what came out of it. They were looking at our Medicaid recipients that were, they weren't able to get Medicaid support until they were in the late stages of, some very serious diseases. And it come to the point then where we're spending, hundreds of thousands of dollars to treat someone with an illness or condition, that if we had done the preventive care and put the resources in prevention at the beginning, then we would have, at that point in time, then we would have saved ourselves a lot of money. I know in health insurance programs that I've seen recently and been involved with, is that a lot of them now are starting to even provide diabetic medications for free, just for the simple fact that way their policyholders will take the medication they need to take, because it prevents such a larger thing from happening down the road. So I think we've got to be able to give that, again, for that flexibility, then to be able to use those funds as they need to in the, with the clinical services. But I think we do have a long-term discussion about why do the taxpayers have to pay for, clinical services when we have a nonprofit hospital that, that's one of the reasons they get to be a nonprofit.
Well, it sounds like a way that kind of addresses what your concerns are, what your statements are, Commissioner Cruz, is if we were to grant the flexibility this year for a one-year period, but it will not be a flexibility next year, and that it gives the Health Alliance the opportunity to do whatever it needs to do to take care of clinical services for next year, but also have the discussions with the hospital that are necessary to make certain that those funds are received if they think it's important. If they don't think it's important, then that's their decision. But I think it's telling that up until this point, they haven't thought it was important, or at least if they've recognized it, they realized it's the Board of Commissioners are paying for it. So if we keep it at the presentation, the $4,231,349, I believe it is. But anyway, that number, given the flexibility to the Health Alliance, with the knowledge that our concern is for the school nurse funding initiative being fully funded, then I think that gives them the flexibility to get through the next 12 months, and also gives the opportunity for further discussions with the hospital authority. Does that make sense, or is there any heartburn over that?
Well, one thing I'd like to say is, I certainly understand and appreciate what the Health Alliance does as far as the community health and the goals you're working towards. And, as I touched on earlier, that, with it being tough for the county, and, I believe everyone, at the time, that I feel it is my job for us to take a look at this and review that. I'm not saying that we need to put restrictions on which programs are funded. It's just, at some point, we're going to have to realize that, there is a need, but there's also the wants, and it's trying to decide, yes, we need this, we can fund that. We want this, but there might not be money there. Like I said, there's a lot of things that, of course, I want a community that, is perfectly healthy, 100%. Everyone, has the full access to care, but there's also the feasibility part of whether or not we can afford that. And, that's one thing with the discussion of the new building. It's becoming increasingly more expensive for Cabarrus County if, the new building's going to be going. You guys are in a financial crunch, and it's ironic that you're going to have a new building, but a harder budget to work with. And so it's, it's a little backwards the way I say it. What's the payment on the Health Alliance building that will come due in 2013, Pam? Do you know? You remember off the top of your head?
Our share is, I believe it's around 1.4 million, but that's for the total issue of that debt. It's not just for that Health Alliance building.
Right. Okay. And the total issue,
It's 35 million.
So it'd be 2.8, half and half.
Okay.
1.4, 1.4.
Okay.
Wasn't that for 17 years?
Yes, sir.
So, one thing.
I thought it was 17.
The goal being, a real healthy community, and imagine what we could do with that much money every year. If we would give that money to you, then perhaps we could, really succeed. So that's where I have a dilemma trying to understand and trying to get to the bottom of. I understand the full concept and I understand what's going on. However, the county's agreed to build this new building. You guys are going to have rent-free, and so trying to get to the bottom of that. I had the multiple questions, and so I've asked, but I think, it's something that everyone should be aware of.
Well, I think going forward, I want to make certain we're all on the same page, is that if the budget is approved as presented June the 20th, it's the consensus of this board that next year there will not be flexibility as it relates to the money, and it'll be specific outlines or specific services will be funded, and those are the mandated services plus the school nursing. Is that what I'm hearing? Okay.
And just for my clarification and having the contract written together, do you want to have something in there that specifies the level of service for school nursing or any of the other mandated programs? Okay, so we'll just do that. We'll come up with employees or something and do it that way.
Okay. Is there anything else, Dr. Pilkington?
If I could just say, Mr. Meismer, I do appreciate the questions because you've caused us the last week to ask a lot of questions we didn't normally ask too, so that's always good to do that. And I would also say, Mr. Chairman, that I had my evaluation with the executive committee of our board today, and one of the things they instructed me was to do exactly what you just said, find a way to get an integrated healthcare system in place, and I've got 1 year to do it, so the orders are there. So you're exactly right. So.
Well, I think, if I could add something here, I think that this goes to the heart of the debate. There's been a lot of debate the last year and a half in this country over, healthcare financing, insurance, how it all works. And if we're looking at 3,500 people right now that, using the services, that's not the full extent of people that are on Medicaid. That's just the 3,500 people that are coming to using our public health services and our clinical services. But it's at the heart of it, and that's what, as we do look at it, having a monolithic, one-size-fits-all healthcare system coming out of Washington, to me, is just, it's pretty absurd. When we have over 3,000 counties in this country that have the ability at the local community level to develop the kind of preventive healthcare system and public health system that can create and ensure and maximize the public health. There's some people never going to take responsibility for themselves and their own, personal health and personal behavior. But I applaud that, because I think that's what we've got to do is look at how do we truly partner. I mean, the county, the hospital, our private doctors, our health alliance, to really and truly look at what we need to do to make this community healthy as it can possibly be. Because I think that in and of itself is going to be a huge economic development magnet for us.
Thank y'all.
Thank you.
Thank you.
Next we have is the Cabarrus County School System and the discussion that we had. That's on page 225. The discussion we had was whether to grant them flexibility or not. Commissioner Caruth could not attend that part of our meeting or our discussions on Wednesday the 1st, and before we made a consensus or a decision, it was decided to put this on today for his input as to if the idea in regards to the flexibility. I saw Mrs. Klutz here earlier. If you want to ask Mrs. Klutz any questions from the school system. The other day, the consensus was not to give the flexibility because of the reoccurring monies of about $5.5 million that's going to have to be addressed next year. Commissioner Caruth, is there any information that you're needing or wanting to think about?
I just pointed out, I think, maybe at the meeting we had with the school system that day, and pointed out since then, is that looking at, my understanding is that we're down through number 37. This is on page 252. I believe we're down to page number 37 is where.
Why don't we stop right there?
Yeah.
Mrs. Klutz, you want to come up, and that way,
sure.
if we're misstating something or misunderstanding something, you can help us back on track.
Okay, looking at page number 252.
Right there.
Yeah, I can see.
252, number 37
Okay.
is clear, and then number 38 is shaded gray. And what we're saying is that right now, without the flexibility, you're going to be cutting how far down? Starting with number 38 on down, right?
Right. We would not get into halfway into 38, or partially into 38.
Okay, so if it's kept like now, we do not give you the flexibility, you stop at 30,
Okay, wait a minute. We're into, this is our reduction list.
this is your reduction idea, so.
We have already made our reductions into 37. We did not get into 38 at all.
Okay, and then, so if we do not give that, so that $6.3 million, you just go down to where it's 7.1 million, so down through 44 is what we're looking at.
Yeah, if we do not get flexibility. All of it is estimated reductions, so depending on how the state finally adopts their budget will impact everything. But based on our projections, that's where we did our cutoff, where the gray is. So we made our projections through 37. So with the assumption that we did not get flexibility, or that we did get flexibility, we ended at 6.3. If we did not get flexibility, okay, let me restate that. If we assumed that we did get flexibility, so we stopped at 6.3. If we did not get flexibility, we would go below that line, another million.
Another million down to, through 44, and actually even into 40, yeah, down to 44, which would cut it to about 7.1 million.
Right.
So what you're looking at is that you would lose your teachers supervising in school suspension.
Right.
Where would, okay, so you use non-certified positions for that. You reduce one elementary teacher for health and PE, and that's by just a allocation method, I guess. So, okay, AIG program would be reduced.
I'm sorry, let me clarify. Yeah. On 39, we currently use certified positions for those positions, but we would then be taking those and making them non-certified.
Okay.
is a lesser expensive, I hate to say cheaper, less expensive way to take care of those positions.
Okay. So in core subjects, you're not losing any teachers yet in the core subjects, even with this?
Not core subjects. Media and guidance are certified positions.
Right. I'm
But
going to say
it's
core. I'm
core,
talking
I
about the core,
understand,
you know.
yeah. They are certified, yes.
So you would not start losing them until you got down to number 50 is where you'd actually start losing the
Mhm.
base core classroom teachers is where you would start losing. So that would be, but with $5 million next year, you're going to be getting down there.
5.5,
Okay.
with our jobs, ed jobs money leaving.
How much is the total maintenance money that goes to the school system?
Is that page 262?
Who has control of this?
Where do you want to look?
The facilities and operations budget.
262, I think is where it's at, what I've got here, so.
Is that what you want to look at?
Keep going up. Should be a summary of revenues. That's just the project revenues. Keep going up.
I got 262 is what I've got.
Feel free to advance that.
Well, okay. Yeah, I can do it here, can I? There we go. The facilities and operations is 5.5 for facilities, 1.3 for grounds. 20. 20. Oh, this one.
Page 20.
Oh, 244.
So the grounds and maintenance is, you said 1.3,
Grounds and maintenance is 1.3.
and then the facility maintenance is 5.5.
5.5, Yeah, there
And
you
the
go.
understanding would be the flexibility of both if the board decided to give the flexibility. Is that correct?
Mm-mm.
Would be just the.
It's 15% of that, which ends up being $855,000.
Okay. Would be the flexibility.
Yes, sir. If Mrs. Klutz, am I mistake? I mean, I think
That's the request.
that's the request is 15%, which would be
800.
$855,000, about $600.
But it's 15% of each.
She's wanting from both.
From both.
So it would be more than the 800,000. Is that correct?
Mm.
No, that's the full
It's-
total.
Yeah, it does add up to be more than 800,000.
But below $1 million somewhere.
Yeah, it's close to $1 million.
Do we have in here, I see, okay, then what I'm looking at is page 262, which is proposed facilities and operations budget, facilities projects. And it lists individual costs and cumulative total, the priority there. And then that goes down, I guess, for 2 pages down from 1 through 21, and which totals $1.533 million. And then we have, I guess for Kannapolis as well, for their projects. Okay, and then we have the grounds projects. Do we have a consolidated list, though, if you're taking the $1 million or the 800,000 out of the maintenance and the facilities and grounds maintenance funds? What would be the things, particularly by priority of those two combined, that you would not fund?
It will
13
not touch
down.
the Kannapolis projects.
Okay.
Only Cabarrus.
Only Cabarrus.
13 down, Commissioner Cruz. If you look at 13, that's where it's 1.1 million.
Okay, and that's only, okay.
So there would not be a replacing a roof or repairing a roof at Mount Pleasant High, Middle, Weinkauf.
Okay. So everything above that would be deferred then? That would be the system-wide alarms, fire alarms, security and locks, camera maintenance, doors, windows.
They're going to fund that.
Oh, yeah.
They're
Those
going
would
to
be
fund
They're going to
those.
fund that, never mind, okay, I
It's
got you.
just
I got you.
that they're going to fund
The thing below
system-wide
that.
fire
Okay,
alarms.
so that's not the list of what you would cut.
Right,
Again,
and
but that's
camera
what.
maintenance. They're not going, and they're going to repair stadium bleachers at Northwest, but they're not going to repair a roof
Okay.
at Mount
Okay,
Pleasant.
that's where I had it, that's where my confusion was at, I'm sorry. Apologize. So you're looking at it coming from the other direction. So these are some pretty hefty things that would be, I mean, if it was just paint, I'd be more inclined to say, yeah, but, I mean, these are some pretty hefty things that we've got here that are going to, what do we do then when we start deferring those things, and that's what we've done in the past?
Well, the question is, if it's deferred until October of this year, they're going to need $260,000 for a roof at Mount Pleasant High if it becomes now a mandatory issue instead of a proposal. So not only did we give them the flexibility, but now we've got to come up with $260,000 to repair that roof.
One thing I think is interesting is some of the repairs, like Harrisburg Elementary School, J.M. Robinson High School, Rocky River. I mean, those are all fairly new schools. And some substantial maintenance that is having to be done on, pretty new buildings. I would think. But as I said in our budget meeting, I'm in support of granting the school system the flexibility for the mere fact that I've spoken with the school board members and the superintendent, and these items were items that they felt could be held off for a year or two during the budget crunch, and these were not life-threatening, anything that will put the students in any danger. And so, as I said, I graduated from Central Cabarrus, an old school, and it was an old school, but I got the same quality education as I would at any of the newer schools. And for us not to grant this flexibility, I think it would hinder the work in the classroom. And if we're having to eliminate guidance teachers or the guidance counselors, and
I think we're not eliminating.
Well, we're not.
It's the state. It's the state of North
Right.
Carolina that's choosing not to completely fund what they need,
Right.
and we're
I
being
understand.
asked to be the stopgap. So
I misstated.
Right,
Right. It's not the county commission that was doing that. However, we do have the opportunity to step in and help in this area, and it's similar to what we were just discussing with the Health Alliance. We're granting them flexibility, but we're not going to grant the school system flexibility. And I kind of think it's along the same lines. As we said with the health department, they're the experts in that. Well, the school board, if they're saying that these items are not, of dire need, they're forced to. They're not forced. They have these projects on the list because we mandate that they spend that money in that way. If they see better fit spending the money within the education and within the classroom, I think that would make more sense.
Well, if you put maintenance off this year, you're going to have less money to spend next year because the economy is not getting better. So next year you put maintenance off again, and you're talking about, roof repair for Mount Pleasant, $260,000. Put it off 2 years, that'll probably be $350,000. All these others, you keep putting them off. And it don't make any sense to me to put off maintenance when you really don't need to.
is it a consensus of the board to approve the flexibility or not? Let me change that. Shouldn't be an or. Is there consensus of the board to approve the flexibility? I know Commissioner Meisner has said yes. Anybody else?
And as much as I would love to do it, I'm looking at going, I don't see where on the project list, the stuff here is, with Commissioner Burridge, you start putting off things like this, you're getting yourself in a wicket. Plus the other thing, that's one thing. The second thing is the fact that we're looking at the pain is there because we're looking at still $5.5 million next year. We're going to be, I don't see the magic bullet appearing suddenly and that $5 million appearing. So we're just putting off one more year what is going to be inevitable. And then the third thing is that, it's still, again, this thing about reduction in state funding. I mean, that's what the state, and the budget that was put together at the state level. And we're doing what we said we would not do, and that's to come back and cover state programs with local money.
Well, I think the consensus is that it's not, that we do not grant flexibility.
It's a hard decision, but it's a sad decision, because I know that there's people that are affected by it, that teach in our system, school systems, and it's going to cause extra pain in our school system, but that is just, I know, unfortunately, where we're at.
Okay. Well, I see that it's that it's not going to be, we will not grant flexibility to the school system.
Mm-hmm.
Okay?
Okay, I do want to ask something. Whether it's with flexibility or without, we know the state's budget is a 2-year budget. We know that we're not going to have any additional funds next year. I know that you were instructed, I guess is a good word, on the ARA funds to use one-time money for ongoing expenses of people. Has the school board, other than this list, has the school board looked at what you're going to do next year? Or is it just flat out, we're just going to go down this list? Because, if I was one of those, and I'm not a media coordinator or a guidance counselor, but if I was one of those, I'd like to know now.
Certainly.
So that even if it was next year that I was impacted, I had a year to go find something somewhere else. Because frankly, I'd jump ship if I knew I could find a place in Charlotte or somewhere, within driving distance. I don't know that that's the case, but do you know what their plans are? And I don't mean to put you on the spot.
No,
but-
you're not. It's fine. I have a plan.
That doesn't surprise me.
My glass is always half full. It's never half empty. Certainly, we are always in a great position with our growth in Cabarrus County. And we've never suffered the impact that other systems around us have just due to our growth. And if we can continue to do what we've done, we've monopolized our growth against our losses. And if you continue to do that and you monitor your fund balance, and then we've projected our loss at 10% this year, and potentially we could be at less than that. Even if you're at 2% or 3%, and we've already planned for these losses. We've already actually sent out our RIF letters and made our reductions, and still, if we stand at that point, we can probably be okay next year. All of this is a juggle, a piece in a puzzle together. My hope is that we'll be okay. I don't like to say that too loud, but I'm always hopeful that we will be.
The number of retirees, I presume at this
Exactly.
point in time, you do know that, or did the number of retirees help to balance out some of the RIF, I guess?
Absolutely. Just natural attrition, we're all the time monitoring natural attrition and not rehiring. That's a constant. We turn over approximately 100 annually, and not rehiring those is a loud statement in our budget.
I know, I just found out about somebody yesterday.
Yeah.
So, or I guess it was late Friday. We found out about somebody that nobody knew about. So
Right.
I know you have a number of retirements that, you hope to be able to backfill all of those, but I would presume some of those.
Yeah, and with the licensure
wouldn't.
issues, you take the attrition, the retirements, and then you only fill the licensure issues that you have, and you capitalize on the growth, and so and then you monitor the reduction list, and then you backfill. So we have somewhat of a plan, whether it's a well-publicized plan or not, I'm not sure, but we do have it's kind of ingrained there. We're planning.
Well, one thing to add is that I think and this is one thing I've watched our county manager and our finance director both do very good over the past several years, is you always underestimate revenues and overestimate expenses.
Absolutely.
And worst case scenario, and I'm hoping, and I'm like you, I talked about a while ago about no silver bullet, but I'm just hoping that, praying this next year, our property values don't drop as much as they're predicted to drop, and I'm hoping and praying that we'll see somewhat of a rebound, so that what we're looking at right now will not be the situation when we get sitting here this time next year. But like I said, though, we have to be prepared, and I'm glad to hear that at least there is already a plan being executed. And It is sad because right just about the time the recession hit, my wife finished up her second bachelor's degree in early childhood, so she watched the entire preschool market for teachers in public schools go away. I mean, just evaporate. You know, that was 2.5 years ago, so.
Have you had a chance to look at the state budget? Because there are some changes to see. I mean, I know there's additional funding, but there's also more reversions. Have you had a chance to look and see, do we
Liz, you're
come out a little bit better, or do we come out
Stealing
worse?
my thunder. I have a board meeting
Oh.
at 6.
Sorry. You can tell me afterwards. I'm just
Okay.
curious.
No,
I was asked that, if you had had a chance to look at the budget.
bleaker?
I'm okay with it.
Okay.
It looks okay. There's some little issues, contingency issues that we're going to have to work around. We don't appear to have as much flexibility. So with class size being reduced in 1 through 3, it's going to make, we're going to have, could potentially have some hiring in 1 through 3, but then we'll have to make some, the cuts elsewhere. So I don't have the details, but certainly the overall cut did not seem as devastating. So,
And that literally was the question, that elementary, or the comment was elementary benefited and high school got hurt.
Could be,
And I
yeah.
said, I don't know.
Well, overall, we're not as bad off. It doesn't appear that we're as bad off overall, and that's what I'm most concerned about. As long as they continue to give us the flexibility, if I can have the flexibility, when they strap me down and don't give me the flexibility, then my hands are tied and it's difficult.
Before you step away, the next thing that we need to, well, have we talked everything we need about the flexibility? Next matter we need to resolve is the issue about the fire truck, the fuel truck. And we had discussed, the request was from the Cabarrus County School System to be allowed to purchase a fuel truck, in that they would use some credits from Kannapolis City School Systems. Why don't you explain it, because I want to make certain I don't misstate it.
Okay. We have the credits. We have the bus credits from going to the 3-tier transportation plans. We have additional credits that we're not using the buses. Kannapolis needs the buses, so we would like for you to fund Kannapolis. So the request is from Kannapolis to purchase buses.
Okay.
So Kannapolis would like to buy the buses from us. We'll take our credits. Then we would have the dollars to purchase the fuel truck that we desperately need to fund, to fuel the buses. Primarily because of putting the 3-tier transportation plan in.
The fuel truck, though, even all that said, it still would benefit Kannapolis City Schools to have the fuel truck, because
Absolutely.
you take care of the buses for both school systems, correct?
Yes, absolutely.
So it's not just that Kannapolis is getting the buses, but they would benefit from the fuel truck also.
True.
And we have this money in the budget? We do not.
It is not, but there's enough in contingency.
It's in contingency.
More than enough in
Okay.
contingency to cover it.
Any questions?
Now, what we have is, we were just looking in your budget at the $90,000. Is there also, is this the total amount of money, net
It's a
amount of money?
total amount. We just
Okay,
want to do
okay.
it jointly together. And
Okay.
we're all on the same page.
So when paying $90,000, we get 3 new vehicles.
You get 2 buses and a fuel truck.
And how
Sounds
much
like
do
a
buses
deal.
normally cost? How much do buses?
$90,000.
Each. So that's 180, and how much does a fuel truck, a new fuel truck usually cost?
I'm not sure.
Okay. So-
Can't be $90,000 for a fuel truck, I wouldn't think.
No, I don't think it would be either.
Sure.
But in doing this, we get 3 vehicles for $90,000.
And the buses are used,
Mhm. Gently used?
gently used.
Driven by a grandmother?
Yeah.
Local mileage?
Right. Right.
Do we have a,
I would add that we do the fuel truck, and take it
Okay.
out of contingency.
Commissioner
And that
Burge, do you have
The trading of the buses and everything would be
do
included.
you have a concern about getting the fuel truck, or allowing this to be done?
Are we buying a new fuel truck?
That's what my understanding was a new fuel truck.
I mean, with all the surplus equipment on the market, looks to me like you could probably buy a good used fuel truck with a savings.
They may be able to do that. I don't, that would, they just need a new fuel truck for the system. And if it comes in under $90,000, then they'll certainly, it will not be the full amount.
So that would be a not to exceed, so that they can try to find sorry, Pam is dying to jump in. Go
I'm
ahead.
dying to jump in. Just let you know that would be the capital account, and they would turn an invoice into us to pay for it. We would not just give them the 90,000.
And one thing that has been done in the past is, I think we talked about a little bit tonight, is the piggybacking, is that if another county or another city, a school system is purchasing a fuel truck, then we can piggyback on it and realize savings on that.
How many fuel trucks do they have now?
2, I think.
For how many, what's your
Just
fleet?
2.
What's
for
your
our
fleet about?
Over 200, 230, I think.
Mm-hmm.
230 running. We have some sitting.
I'm sure it's hard to run all them by the service station, too.
Yeah.
Do you have a problem with Commissioner Meesman, Commissioner Caruth? Then the consensus is to go ahead and do the fuel truck. Thank you, Mrs. Klutz.
Thank you.
Enjoy your meeting tonight.
Thank you.
Why don't we take about a 10-minute break and come back at a little after 5:15?